It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. And it must be Friday. And indeed it is. It is Friday, January 17th. Where is the time gone? We are in 2020. And today, if you are listening to Health Futures for the very first time, our show is about how older adults can live a healthier, happier life. And how can they do that? They can do that by listening to the show because we bring extraordinary guests. We're in our 7th year. It's hard to believe it. We've done over 300 shows, and if you want to catch up on any of our previous broadcasts, go to cypresshomecare.com. Click on the media button, third button down is radio show. You can catch this show and 300 others. So today, like I said, what makes our show is the content we bring. We bring extraordinary content because we have extraordinary guests here on the show. And first and foremost, I have to say I have in the studio, in the house, a guest who has made multiple appearances on the show. He actually even had a radio show on the show. Scott Fischer, President, CEO, and founders of Options for Seniors. And you also were the creator of a great trade association called Passers. Welcome to the show.
Good to see you, Bob. Glad to be here.
It's good to have you. And then just to my right and Scott's left is Lori Cummins. And Lori Cummins, she runs a healthcare consulting and education business. I've had the pleasure of knowing Lori for almost 25 years. And she is a healthcare experience veteran, wouldn't you say?
Thanks, Bob. Yes, that's like how I'd like to describe myself, a veteran.
So here we are. We're halfway through the month of January. It's hard to believe. But, you know, as we get going into 2020, I really want to talk about some of the challenges that we are dealing with. And, you know, I really want to make this first month an episode, or should I say a series of episodes that we really address some of the issues. And, you know, I had a chance to read not too long ago a column that was written right at the beginning of the month by a fellow by the name of Howard Gleckman. And he says that the 2020s will be a tipping point for elder care in the U.S. You know, I think it already is. But it's interesting that, you know, we are finally starting to address some of these issues. And for me, you know, one of the things that was really, really daunting for me was that decades ago, they said 30 years ago, at least Howard Gleckman said this, that a commission was named for the legendary aging advocate. His name is Claude Pepper. And they laid out a solutions in this comprehensive report. You can find it in Forbes magazine. And U.S. policymakers did nothing. And here we are. We're on the brink of a crisis. And both of you guys are involved in this. And Lori, you just left a couple year stint with a very large acute provider. And you saw a lot of stuff there. And, you know, I don't want our listeners to really walk away, you know, feeling like, oh, it's doom and gloom and, you know, it doesn't look good for our future. No, we have to talk about the issues, but then what we need to do is we need to talk about how do we solve these issues? How do we problem solve through these? Because you know what? This country's great, and when we put people together and we have like minds and we're really targeted with a mission, good things can happen. I really believe that. So I'm looking at you, Lori.
Yeah, absolutely, Bob. I agree. I think the networks and the relationships and the ability for people to reach out, and truly I think the game changer is going to be people being educated. They've got to understand what's happening in the healthcare industry without too much of anyone understanding the very fine details of it, but obviously you've got to be educated to know what are your different options for healthcare in this day and age. Because to your point, we are we're breaking the system. The Medicare system can't be sustained. And with that, then you have to look for other options and other avenues to be cared for. And everyone's going through it, from the hospital systems to my friends in the home health and home care environment like you have, Bob. Everyone's going through how are we getting paid for taking care of this aging population.
And the crazy thing is, we all know about the baby boomers. And by the way, we're all boomers, right?
We're back in line pushing forward, but
you're not a boomer. You're next gen, aren't you? Oh my gosh, you just missed it.
By 1 year.
By 1 year.
Oh.
But he and I are boomers. But literally, even though we're boomers, I mean, collectively, and you're on we've got about 100 years experience here in healthcare and in business and dealing with people. And these boomers are turning 65 at a clip of 10,000 a day. And here we are in 2020, and before the end of this decade, boomers are going to begin turning 80, and then they're going to turn 85. And why do these mile markers mean anything? And by the way, Scott and I, being a little bit older, we're getting closer to that 60 number. And just so you know, for our listeners, I hear people say this, and I truly believe it. I want to believe it in my mind that 60 is a new 30. Scott, you'll take that, right?
I will take that.
60.
My joints don't feel like that, but I'll take that.
But my point about 80 and 85, so when you cross over to that 85 barrier, I mean, we know this because we're in healthcare, right? If you have someone that falls and injures themselves by fracturing their hip or their shoulder, they have a 50% chance of mortality within the first year after that fall. And we also know that 40% of people 85 and older have high personal assistance needs. They have at least 2 activities of daily living that they need support services on, and they are not able to age successfully in place. Those are some major barriers that we have.
Absolutely, I agree, and I think it's going to be a toll on the family members being responsible for these aging loved ones, especially if it's geographically complicated, if you don't even live in the same area or in the same state. Again, going back to who's going to pay for those kinds of things, who's going to transport them if I have to go to work and they need to get to outpatient therapy, who's going to handle all those things. It's
so funny to hear you say that, because look, you were entrenched in the acute system for a couple years. Scott and I've been doing home care now in my 17th year, and Scott pretty much the same in the placement business. We all have to have that conversation about money. Who pays? I mean, look, we're going to get into some of the other things that are happening this year and into this decade, but the fact of the matter is we have to have these money conversations. And here we are on Money Radio, and I know that the other shows that come on prior to us and after us, they talk about investments, but they also talk about planning and saving. And, this generation right now, and I'm talking not the next gens, I'm not talking the Gen Ys, I'm not even talking the millennials, although it does include the millennials, but I'm talking Gen Z. They need to start thinking about this and start putting away funds, because what you do in placement, what I do in home care costs a lot of money.
A lot of money.
All you have to do is go to Genworth, and they give you some of the data.
It's always shocking to me when I sit down with a family or maybe do a presentation for a small group, and they ask me the question, well, what does my Medicare cover for assisted living? And you have to break their heart and say there's absolutely no support coming from the federal government for your assisted living care. So,
and you know what? For us, it's 50%. Is it 50% for you?
Oh, yeah.
Absolutely. I mean, it's crazy because they all think that they're going to pay for this.
Right. Absolutely.
Well, we do have sunshine on a cloudy day, and I can't thank you enough, Adam, because that is very apropos, because, it is kind of got that feeling that it's rainy and stormy, but I want to be optimistic about sunshine coming in. And I don't want to lose our listeners, so stick around. We're going to problem solve together. We may not come up with all the answers, but we'll bring you rich content relative to healthcare and where we see this going in the future. You've been listening to Health Futures Taking Stock of You. I'm your host, Bob Roth. Scott Fischer, Lori Cummins in the studio. We'll be right back.
I've got sunshine
taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're on segment number 2. And I've got Scott Fischer from Options for Seniors here in the studio, and I've got Lori Cummins. She's got her own consulting company called Cummins Healthcare Consulting and Education. And we are talking about the aging crisis, because it truly is a crisis. Like I shared in the first segment, if you missed that first segment, our policymakers 30 years ago had this very discussion, and they actually put out a report. It was named for the aging advocate, Claude Pepper, and here it is. 30 years later, we're still dealing with the same issues. And it's not just healthcare, it's aging. It's aging situation.
Who would have thought this was going to stop? Aren't we all? I mean, we're on a conveyor belt to someplace, right? And people think that it's not affecting them, and they just, a lot of us have just turned their head to it, I guess, over the years.
Put our heads in the sand.
Yeah.
So, I looked at Lori, because Lori's coming fresh out of an acute provider. And, you see a lot. And I really appreciate you bringing up the money thing, because, look, somebody's got to pay for it. And, Scott and I, we sit here and we deal with this. And, the biggest challenge that we're dealing with is the fact that wealthy people can afford private care. Wealthy people can afford a lot of these CRCs that are here in Scottsdale and around the area. I mean, look. Even just in Scottsdale in a group home, the average monthly rate is what, about $4,000?
About $4,000.
About $4,000. I mean, you do the math. I mean, we're talking about $52,000, but that's with after-tax dollars. So you got to earn $75,000. You can spend that money really, really fast. So we got to figure out solutions, because you got that group, and then you've got the Medicaid group, and that is people that are 138% below the poverty line. And you can't really have more than $25,000 in the bank and make more than $2,200 a month. So what do you do with everyone else in between, Scott? You and I have this conversation every day, and I know we're not going to problem solve it right up front, but right. I mean, the money thing is something we have to talk about.
Well, and I think to educate people first on what's currently available through public benefits and things, you have to let people know that this program we called All-Tex here in the state of Arizona is really a super program. It's very helpful. In my travel, I've gotten to go to Texas and Arizona, or California, Colorado, and some other states. And our Medicaid and All-Tex program is superior to what other states see. But the reality of it is that people think just because they're broke, they're entitled to public benefits. And unfortunately, there's a medical or a healthcare assessment that goes alongside of that thing that prevents people from qualifying until they need those care with help with activities of daily living. So there's a lot of people that are stuck, and I talked to one this morning who makes about $1,600 a month, would financially qualify for All-Tex, and she's driving and happy, but her husband needs help. I mean, it's just these are the stories I hear on a regular basis. So families are forced to step in. Families are providing the assisted living or the care in their loved one's home. Faith communities really fill the gap in a lot of ways. We just have to, I think, formalize more of that and educate those families that are in this position. My mom's in that position, Bob, and I, in a sense, provide her with her support so she can remain independent when, in fact, she's really not independent at this time. Yeah.
Well, and it's a fact. I'm going to share some data with you. According to the Government Accounting Office, more than half of the households near retirement, that is somebody that is 55 plus, have no retirement savings. And about half of our own population have no pensions beyond Social Security. We are running into tens of millions of people that are going to be impoverished aging boomers. And they're going to put a huge burden on our economy. I mean, there is no doubt about it. And, the one thing you left off when you described our state's All-Tex program is you talked about healthcare requirements. We didn't really talk about the economic requirements. Right. I gave you the 138% below the poverty line. But guess what? When we hit that recession that we got in 2019, 2018, 2010, we had a lot of older adults that were 65 and older that lost everything. And there was a time where Medicaid did a 3-year look back. Now it's 5. So that means if you lost everything, if you were tied up in real estate then, or if you lose everything today, it doesn't mean you can have access. They look back for 5 years.
That's right.
And you'll have to go those 5 years without being able to get onto the program.
It'll really preclude people from being approved financially because it'll look on paper that they had all these resources that were on paper that they don't have any longer.
Right.
Yeah, they can't access.
So, I look to you, Lori, because I truly understand Scott's space because, we are so closely aligned when people just can't really do it by themselves anymore. And if they need assistance at home, they're able to do it with a friend, neighbor, family member, and then they look to a home care agency. We always try to encourage an employer-based agency versus hiring an independent contractor. But, here you are, you're in that post-acute or acute setting trying to transfer someone into a post-acute or back home. I'd love to get your lens on some of the things that you saw.
Yeah, it was really amazing to me because as a nurse, I started my career in St. Joe's Hospital working on the floor and being that patient bedside caregiver. Went into the home health space and into post-acute in St. Joe's as well. Early on in my career and have kept in the post-acute space. And post-acute might be something that people don't even understand. That might be a language that people don't truly understand what the difference is. But if you can think of the hospital stay, it's something that's acute that's happened to you and you end up in the hospital. Everything outside of that hospital, what my department was responsible for was moving that patient to the next level. So whether that was a skilled nursing or a rehab, into an assisted living, helping getting placement coordinators involved to help. What is that next step? Home health, home care. Bob, I think what you hit on is with this reimbursement change and with all of the things, you guys have brought up All-Tex and Access, and some people might not even know what those acronyms even stand for.
We throw acronyms out all the time.
And I think I go back to my first statement about educating yourself, educating your loved ones, because you have to understand when someone goes into an acute care setting with some kind of crisis, say that broken hip or broken leg, the hospital isn't looking at what is covered for the next step. And I think that that's one of the biggest barriers to our healthcare system from the acute care perspective, because they're looking at how much money am I going to get? It's a DRG. How much am I going to get?
What's DRG stand for?
Diagnosis Related Group.
Okay, I just want to...
Yep, and that's based on, what is that diagnosis you came in with? And that's how much money the hospital's going to get. And that's already been paid for by the insurance company. And they estimate a 5-day stay for something like a fractured hip. You stay longer, the hospital loses money. So it all ties around the money, the reimbursement, and you being educated to, do you have a VA benefit that potentially could help you on your post-acute journey after the hospital stay? Are you eligible for All-Tex? Should I be talking to the social worker about getting my mother into a group home or getting some personal caregiving put in my place so that when I have to go back to Texas, I know that she's got a caregiver that can do all those personal ADLs, those activities of daily living like the laundry and the shopping and those kinds of things.
So what I'm hearing you say is that conversation isn't happening early enough in the acute setting. It happens right at the end. And if we were really mindful when we bring on these patients and we check them in, we should be having a needs analysis and transcribing a lot of the information that you were just describing. Get that on paper and start the planning right then and there about what this is going to look like when you no longer are here in our hospital.
Absolutely. And that does happen. I mean, that's the role is we start discharge planning upon admission. That's the golden standard. And there's amazing case managers and social workers out there that do that day in and day out. Unfortunately, sometimes with caseloads, sometimes with the way we structure staffing, you might not see the same person you saw yesterday. So even though your daughter told, everything that needed to happen or your wants and your wishes and your desires for, I don't want to go into a rehab. I want to go home. I want to go home with a therapist, or I want to go home and get outpatient therapy that a caregiver could drive me to. So again, there's all kinds of, and it depends on what's going to be paid for. And you're not going to know that until you do your own individual research on what your plan is and what your family looks like.
Exactly. So we threw a lot of acronyms out to you. So ALTEX for our listeners is Arizona Long-Term Care Services, and ACCESS is Arizona's, I love this, Arizona's Health Care Cost Containment System. So they're trying to be very mindful to really try to pull back the costs. But we know that the costs are going to be just continuing to grow because our aging is growing. I mean, the needs are growing. So, Scott, we got about another minute left. Tell me some of the things that you're saying.
Well, people are prepared for maybe a year or two of assisted living, and so maybe there's $50,000 or $100,000 in the bank, but they are not prepared to go for years. And so we often have to help them make contingency plans or combine public benefits with their primary resources to help them go the distance. And we have to be pretty creative about how they do that. Alternative funding solutions, using the assets that the family has to make it happen.
One of the great resources, I talked about it earlier, is the Genworth Cost of Care Survey 2019. You can look that up online. I can give you a good sense of what things are going to cost. Hey guys, we're at halftime here at Health Futures. It's hard to believe it. We got 2 segments down. We got 2 more to go. Stick around. I got Lori Cummins and Scott Fischer in the studio. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth. And if you're just tuning in, we're in our second half of our show. We're coming at you live from the Scottsdale Air Park. It is Friday, January 17th, and I've got Lori Cummins and Scott Fischer here in the studio. Between the three of us, we probably have about 100 years of experience. Isn't that crazy? I know. Lori, you're looking at me like, I'm not even a boomer.
Don't say that.
I am a Gen Xer, man.
We
I
are
am
centurions collectively, right?
Yeah. But, with that comes wisdom. And it comes knowledge. And, we left off at the last segment really talking about the cost and that the pay piece is so big. And I left our listeners off with going to Genworth, the cost of care. And they put this out every single year. And I do have to share with you, it was the biggest leap I'd seen HomeCare take in a long time. And that leap was really more attributed to this minimum wage increase that just happened January 1st here. We went from $11 to $12. So we had a 5% increase. So when you really think about the average person receiving home care, and that person is receiving home care typically about 5 days a week, 6 hours a day, and that cost for home care is about $60,000 a year, and with a 5% increase. So I can put things in perspective for people. Adult daycare, it's about $30,000. Assisted living is $42,000. And again, Scott is in this field, and we talked about it earlier. That's a little bit on the lower side, but that is looking at all of Arizona. And then nursing homes, we're looking at a semi-private room of about $76,000 and a private room about $115,000. Are you seeing that, Scott?
Oh, absolutely. And when people want a lifestyle that maybe they've been used to living for their mother or father, if it's the kids picking out their senior living for mom or dad, $42,000 would be low. It would be significantly more than that for assisted living, whether it's in a private residential setting or one of the corporate assisted living centers that you referenced that are all over town.
And, it's important for our listeners, and if you're one that is potentially needing care or you're an adult child, this station's a great station to listen to. If it's not listening to this station, reach out to your professional, CPAs, attorneys, financial advisors. We really need to start planning for this. And we said this very clearly in our earlier segment. Medicare, listen up, wake up, people. Medicare does not pay for long-term care services. They do not. They may pay just for a limited amount to get you set up. Medicare Advantage, which CMS back in April 2018, they made the big announcement that Medicare Advantage could offer in-home care services, which we are all elated about. But candidly and honestly, 3% of the MA plans authorized it in 2019, and the highest amount of hours were just north of 100 hours per member per year. And that, in my mind, is more geared and akin to the area you just left, Lori, and that is for transitionary care. Mm-hmm. Knowing that somebody needs to leave an acute setting, they don't want to go to a rehab, they want to go home, and 48, 72, 100 hours would probably be exactly what they need to get them settled in. Their meds right, make sure they have meals, make sure they've got everything that they need to be able to live comfortably at home.
Yeah, exactly. But I think it goes so much more than that, right? So that's not enough. That's not enough hours for someone to be sustained. I mean, it's not, we need people to get back to their primary doctor to let them know what has happened after their hospitalization. We need those medications to be looked at. Medicare's medication reconciliations with the number one cause of hospital readmissions. People go home on their meds. They don't know what they had at home. They start taking the ones that have been prescribed from the hospital. More often than not, they can't afford some of those medications because it's either that or the grocery bills. So I think it's critical that we start looking from a legislative standpoint, from those people that are in charge of funding these kinds of things. And that's talking about CMS and, Centers for Medicare and Medicaid Services at a federal level, but it's also talking about that here at a state level. We've talked a little bit about Access and Alltex in our state. I think we do a great job here of providing those services, but there's also more that can be done from a legislative standpoint.
Well, and I'm glad you brought up the food versus medications because, we're sitting here talking about affordability and I know our current president's working really hard to try to get prescription drugs down because it's ludicrous how much money is being spent. I think my father's medications are probably close to $8,000 a month. I mean, $8,000 to $10,000. I mean, fortunately, he can afford it. Mm-hmm. I mean, but it's crazy how much these medications cost.
Yeah.
And, I mean, we have to figure it out. We have to figure that out. And I'm glad you brought up the legislative piece because I really think that that's the piece. I mean, we're in election year. I mean, we are not just voting for a president. We're voting for lots of other positions within our state government as well as our federal government. We're talking about the Senate seats. We're talking about the U.S. representative seats. These are things that we really need to be mindful of. And if we can come together and let our state congressmen and senators or Congress folks and senators know that, we need to address this issue of aging. It is a crisis. And then we need to also do the same with our U.S. senators and our U.S. representatives and let them know. I really believe that an organized effort that can bring people together, great things can happen. We need to start talking about this.
Bob, I get to participate in a group down at the Attorney General's office on healthcare issues, and we talk about breaking down silos. And the chairperson of that group, and it involves a lot of different segments of the community, from public health to the private sector, and it is repeatedly brought back around at those discussions, particularly with our first responders, that they engage and encounter people all the time that are in that tweener place. And it really, when I work or talk to the private sector on the assisted living side, they're for-profit entities. They kind of look at you and go, well, we'll pick up the part of the population that can afford this, right? There's no reinvestment yet, or no buy-in for some of that to reinvest to help those people that are in that in between place. And I think some of it's going to have to come from private business, some of it's going to have to come from the government. And I said, I think faith communities long-term play a huge part in this as well, because they're connected to, people are connected to their community of faith wherever they come from. And I think from the top down, we have to bring a lot of people together to educate them that we're going to be more of a neighborhoods taking care of neighborhoods and those kinds of things where we share the costs amongst a neighborhood to have a caregiver serve lots of families, not just the rich or wealthy one in the middle of the neighborhood that has the money for it. So I know these are going to be innovative, out of the box kind of ideas, but it's going to be a lot of brainstorming from really smart people that are going to solve these problems, I think, Bob.
Well, I couldn't agree with you more. I agree 100%. And I mean, we know that, roughly 28 to 30% of the Medicare dollars are being used to take care of people in their last year of life. And, we have to be smarter. And I know where you're going with this because I've sat on Dr. Nairi's committees and, he's a big advocate of advance directives and being able to really memorialize your wishes. And quite frankly, I mean, what better gift could you leave for your family?
Well,
right?
There's more to talk about, too, as it relates to how people view their chronic illness and when end of life should come. And I don't know you want to go there in the last segment, but that's another part of this conversation.
Well, you know what? We're all going to get there, right? They say there are two things, taxes and death are guarantees in life, and we're trying to escape that last one. It's kind of like that bouncer in the bar. We're underage. We're trying to get underneath and get past that bouncer. It's hard to believe it. We're down 3 segments. And, we're listening to Little Lover Boy. We're working for the weekend. So maybe we can talk about our weekend plans after this.
Sounds great.
You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. You got Scott Fischer here in the studio. He is with Options for Seniors. And we got Lori Cummins here in the studio as well. She's a consultant in healthcare and education services. Stick around. One more segment. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're on our 4th segment. I've got Lori Cummins in the studio, and I've got Scott Fischer. We are talking about a lot of things, but the main thing we were talking about is just the sheer fact that we are aging at such a rapid rate. And, the 80-year-old population in our country between 2014 and 2030 in 16 years is doubling. So the stress and demands are just unbelievable on families, on local municipalities, state governments. I mean, how do you spread dollars? I'm a Medicaid provider here in our state, and we're trying to keep up with these minimum wage increases to get more increased dollars. There's not enough of the pie to go around.
No, absolutely not. And the senior living providers, the small mom and pop operators or residential homes, they have a really hard time charging what they need to charge in order to have staff that are awake all night or to have shift work or pay their caregivers the right wages and not, cut the government out of their compensating their workers and to keep their business above board. So it's a very complicated issue and one I have to talk to families about as they start selecting long-term care solutions for a loved one. If you're looking at an assisted living home, it might shock you, but the state of Arizona doesn't require those small operators to carry liability insurance. That's an extra added burden of expense to them. But Could you imagine not taking care of someone that, and your loved one in a house like that, and there's no liability insurance in case bed sores or a fall or something unforeseen were to happen? So again, it adds to cost, and I have to talk to families about those kinds of things when we start creating a plan for them and helping them find solutions.
Yeah, we talked about end of life too in the end of the 3rd segment, and there's a lot of questions you can have with regards to that, and there's a lot of spirituality questions that really come to mind. We could spend a whole show on that, and I want to kind of leave off at a positive note, as much positive as we can, and that is, like I said before, if we can bring people together and we can rally together for a good cause, great things can happen. We have this election coming up. We have state positions that are available, federal positions that are available at presidential election. We need to really look at those folks that are addressing this ageism issue. It is really, really a big deal.
No, I totally agree. And I think from our industry's point of view, collective, I don't mean just the referral and placement, but I think collectively, all those of us that touch seniors, it has to be brought home to us as families and constituents and all that. When you sit in front of families, particularly families that there's some broken relationship in, or there's been second marriages into, Bob, you have even more challenges with getting everybody on the same page and get more trouble. And I know you are in your business, social worker, pastor, minister, a lot of times with people, but it takes that. It's not just us as professionals. It takes the layperson to be involved in these conversations with their loved ones as well. I mean, I have to spend a lot of time breaking down denial and barriers, right? This isn't happening to me. My mother-in-law is like, and her friends are in that group where they just, they're starting to take note, but they're in their 80s. They're finally taking note, like, hey, things are changing here. And it's that constitution has made them successful and robust generation, but that it's also tied to a certain amount of like, this isn't going to happen to me. And I don't want to call it arrogance, but there is a certain line of invincibility and pride that comes with recognizing that you need help. And I think a general conversation between us, hey, this is real. We have got to talk to each other, family to family, neighbor to neighbor, and break down some of those denial barriers and this isn't happening to me kinds of conversations that happen. And I would follow a legislator that would get down in the dirt with us and talk about those things. I mean, to fight back to what you're saying.
Yeah, absolutely. I agree wholeheartedly with everything that you're talking about, and I can't stress enough just with that familial or that neighbor or significant other relationship to have those conversations early and often, because our elders are entrenched in their ways, their histories, and it's hard for them to understand that it is coming to an end. And it's not an easy conversation. There's a great workbook called The 5 Wishes that hospice often uses. That's an amazing, you can download that. It's an amazing way to start those conversations. And I think, again, going back to kind of my first comments, you have to educate yourself. You have to educate your own family and your own friends and your own neighbors, because we can talk things at a legislative level, which amazing. But, I would come away from this saying, what are the couple of things that I can do for my loved one? And just that education, starting the conversation, being prepared, asking the questions. Don't assume that because your medical physician said one thing that's the right course of treatment, or it's going to be. Yeah. So just always question, know that you're empowered as a consumer. That's what this is. Healthcare is not often seen as a business or consumerism, but that's exactly what it is. And we need to be more in favor of our own destiny.
We've talked a lot about a lot of things here. And Lori, I think that's probably the biggest thing I want people to walk away from is the fact that you're in charge of your own healthcare. I mean, you can decide. You can write your story. I mean, that's the beautiful thing about it. You don't have to listen to somebody. And doctors aren't always right. They really aren't. And if you are somewhat concerned, go see another doctor. Go do your research. The internet's a powerful thing, and lots of docs tell you to stay away from it. And I can understand why. But there's also some really good research that you can do and become better and more informed.
Absolutely.
If you grab on, just take that thought another step. If you grab onto the idea that you're in charge of your healthcare and you're empowered to make decisions, then don't live in a place of denial, though. And I think that's where we're in those relationships of that we love and care for someone. I say to my mother regularly, Mom, I love you. I would never do anything to break your heart or take your dignity. But if we have to talk about you giving up your driver's license, it's in your best interest to give up your right. So frequent, you said often, it's frequent conversations with our loved ones that allows them to then trust us as the next generation to give them the help they need. or else she's going to be dependent on an assisted living place and she can't afford it.
And you know what? You're right. It's frequent. It's not one conversation. That's for sure.
And I just have a kind of a anecdotal story to that, because the way my mother was aging in Wyoming, and of course I was living here with 2 small children, so it wasn't easy for me to get back and forth. So of course I wanted her to have one of the life alert buttons. And I finally used the old guilt method with my mother and said, you know how much stress you put me under every day. I can barely sleep at night knowing that you're in this house and may fall. And that was the one thing that if I turned it around to that's really affecting me on a negative basis, she was willing to do it. So sometimes you have to be very creative.
Well, and you know, and
mother's guilt.
And that work, mother's guilt, for sure.
Know your audience, right?
So I have a couple quick questions for both of you guys, and I'm going to start with you, Lori. You know, what comes to mind as the single most important area to address as we build better ways to age?
It's absolutely the reimbursement and the partnering of the different providers. We're all in silos now, hospitals versus what happens on the outside of the hospital versus the physician versus the first physician you see inpatient versus the physician you'll see when you leave the hospital. So yeah, that commonality but the commonality starts with the patient and the family members. They're responsible to keep their own health history. Go to your physician with your med list, please. Let them know you were in the hospital, please.
And just so our listeners know, I did not pre-plan this, and those were great answers, but thank you. And Scott, I'm going to ask you the same question. What comes to mind as the single most important area to address as we build better ways to age?
I'll take it from the assisted living and senior living side, is that that industry has really evolved, as I call it, the cul-de-sac of the healthcare system. People are going to the healthcare system. They're sick. They're frail. They're declining. They end up in the assisted living. And I want the assisted living industry to take that role seriously, become a better, more dependable, consistent product, have more healthcare initiatives within it, better training, because that environment is where people will live out the rest of their lives in a lot of cases. And under what I see now, it's often inconsistent and erratic, and I would love a better product long term.
So would I. It would be beautiful to have a consistent, better product.
Right.
Any final thoughts? You do anything fun for the weekend, Lori?
No. Last weekend was my birthday, so this weekend I'm continuing to age, apparently.
And how about you?
I get to take my grandson shopping tomorrow, out for pizza for lunch. So I'm having and then I get a little getaway and go to Ohio next week for a family vacation.
You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. What a pleasure it is to have Lori Cummins and Scott Fischer in the studio. Thank you for coming in almost last minute. I think we put on a great show. Can't wait to do it again.
Thanks, Bob.
Thanks,
Appreciate
Bob.
it.
Appreciate it. You bet.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.